Welcome to our episode of the podcast series where we'll discuss pressing issues at the intersection of ethics, policy, and global health. I'm Gurdeep Kaur.
And I'm Parvanita.
Today, we are focusing on a crucial topic that demands our attention and action: bridging the gap, equity in Southeast Asia healthcare for refugees. In this episode, we'll explore the multifaceted challenges faced by refugees in Southeast Asia, a region known for its rich cultural diversity, yet faces significant disparities in healthcare access. As we navigate this complex landscape, we'll discuss the barriers refugees encounter in accessing quality healthcare, the role of policy in addressing these disparities, and innovative solutions that are making a difference.
We're incredibly grateful for the opportunity to speak with our distinguished guests. Associate Professor Dr. Sharon Kaur from the Faculty of Law, University Malaya, and Dr. Sushila Balasundram from the United Nations High Commissioner for the Refugees. We would like to extend our heartfelt thanks to both for taking the time to join us and to share their invaluable knowledge and expertise for today's podcast.
Dr. Sharon, to start off, could you help us define the terminology we are working with? Specifically, what is meant by equity in the context of healthcare, and how does it differ from equality?
Hi, Gurdeep. Thanks for inviting me to this session, and thank you for the question. So equality and equity are two rather different concepts. Equality just means that you treat everybody the same way, but equity actually asks you to look a bit more closely at the conditions in which people live or struggle and see how you can actually achieve an outcome that you want based on their context. So I'll just maybe quickly talk about a picture or an illustration that most of you will be very familiar with of three people trying to look over a fence. One person is very tall and he can easily just look over the fence by just lifting his head. The second person is slightly shorter and he has a bit of trouble. He has to stand on his toes, whereas the third person is really short and even jumping, he can't look over the fence. So when we think about equality, you would say, okay, in order to look over the fence, you need a box. And if we treat everybody equally, we would give them the same box, right? So that's equal treatment. But if you give the guy who can already see over the fence a box, it's not going to make a difference. He can still see with or without the box. The middle guy, if you give him a box, a regular size box, that probably makes a huge difference and he can now comfortably see. But the really short guy, if you give him the same small box that you gave the regular size guy, he still won't be able to see. So although you have treated them equally, you have not treated them equitably, because and what is equitable treatment depends on what you're trying to achieve. So if you're trying to achieve helping people to see across the fence, treating them equally really doesn't help. So similarly, when we think about access to healthcare and we think about migrant or refugee populations, we can say we treat them equally the same as any other Malaysian, or we treat them equally the same as any other foreign worker. But that may actually not be equitable, right? Because maybe if you say, well, everybody gets charged the same amount, but we don't let refugees work, so how are they supposed to pay for it? Everybody can come into the accident and emergency, but if you have policemen there that might arrest the refugee, they don't have equity. I hope that kind of helps.
Also, Doctor, could you explain the term of refugee in this context?
Yeah, so that's a really good question. And interestingly enough, from a completely nerdy academic point of view, which is what I am, the terminology used in this area is in fact a matter of some contestation. Some people use the word refugee, some people use the word migrant, some people use the word displaced. Typically, I think when we think about refugees, we think about people who have been forced to leave their country or the area where they live because of extenuating circumstances. Usually it's because of conflict or violence, and it's unsafe for them to be in that situation. But we also have people who migrate for different reasons. Nowadays, you have environmental reasons why people move from one area to another. It might actually be economic migration as well, because you can't find any food, or you can't earn a living, so you can't get a good job, you can't feed your family. And I would be interested to know what Sushila thinks about this too at some point. But I think that the term that we try to use in our network is not so much refugee versus domestic worker or construction worker or environmental worker, migrant. We just try to use the word migrant, which is just somebody who leaves the area that they live in to go somewhere else, either temporarily or permanently. And it can be within a country. You can move from one part to another, or you can actually move from one country to another. But I think when we think about refugees, that's actually a very specific term of art, and the people that Sushila works with, I think, fall under a very specific category of people who are forced to leave because of conflict or violence.
I see. Thank you so much for explaining the different terms, Dr. Sharon. I think it's really something that we should take note of. I think not many would have heard of the difference. So thank you so much for that. Now, Dr. Sushila, this question is for you. As someone who has worked for many years on health issues at the UNHCR, what do you see the biggest significant gaps faced by refugees in accessing healthcare in Malaysia?
Thanks very much, firstly, to this whole group for actually getting me over to speak on this issue, which issue close to my heart. Probably I'll start by also addressing what Sharon was explaining in terms of the difference in terms, because of course UNHCR's mandate is specifically for refugees, and the term itself actually denotes people who have been displaced, yes, but forcibly displaced. And they, because of the reasons related to whether it's a persecution of race, religion, nationality, or the fact that they're belonging to a particular political opinion, or having membership of a particular social group, is not able to return. That makes that big difference between migrants and refugees. Migrants can still return to the protection of their own country, however, refugees may not be able to do so. And having said that, in Malaysia, in terms of healthcare, of course, Malaysian health system, the Ministry of Health actually provides for access to non-citizens. Among the non-citizens are refugees. So non-citizens have a special rate in the government hospitals which is way above what Malaysians pay. So it's not exactly the same as what Malaysian nationals have to pay, which is a highly subsidized rate. Refugees pay maybe half of this, in accordance with a circular that was issued by the Ministry of Health in 2006. This still is a huge challenge, because in an environment where they're not allowed to work, how do they afford their subsistence, and also how do they afford the needed healthcare they need? So it's a huge challenge, particularly this financial issue of having to pay huge sums when they access a very basic healthcare. Besides that, also, of course, they have their language barriers. Many of them may not speak the local language, and if they do at all speak, it may not be enough to explain what problems they have sufficiently for the doctor's understanding, or for the healthcare personnel to be able to manage the case in a more comprehensive way. Also, there's a security risk when they travel, and if they don't have our UNHCR card in terms of registration, they may not be able to access or the discount, or even sometimes they are denied services itself. So these are kind of the main struggles that community members face in accessing healthcare in Malaysia.
Thank you, Dr. Sushila. It's really eye-opening, especially for us as Malaysian citizens. We could not foresee that these refugees, they are facing the difficulties, especially with language barrier. Therefore, before we discuss what Malaysia has done so far in providing assistance, let us just have a general understanding on access to healthcare in our country. Approximately 189,349 people are refugees and asylums seeking registered with UNHCR in Malaysia as of May 2024. How does registration with UNHCR impact their access to public healthcare in Malaysia?
Well, in general, the circular from the Ministry of Health actually states that they will be afforded the 50% discount off the foreigners' rates, which are really high as well, if they hold UNHCR documents. However, if they do not, then they will have to pay the full non-citizens price. So that is a huge impact on them for sure.
All right, thank you for that, Dr. Sushila. And a follow-up question to that would be, where do they go for assistance?
By and large, they will try to go to the nearest clinic, and sometimes this may be an NGO clinic, which may be providing services for free or at a very, very minimal token price, like 10 ringgit for registration and the whole treatment. Or they might go to the nearest private GP clinic and pay for the services. If they don't have a document, sometimes they're really afraid that they might be reported to the police when they go to public facilities. Hence, they may opt for such services. But some of them may be quite used to already accessing healthcare in the public health facility. So if that's the nearest, I suppose they will still try to pay the amount at the clinics or hospitals nearest to them, because travel is also then a cost to them. So in Malaysia, we have quite a number of NGOs throughout the country serving refugees in whether they're providing static clinics or they are doing outreach clinics. However, a large portion of these services are mainly on the west coast of Malaysia. So we do have a lack of services, particularly in the East Coast states. There are a smaller number of refugees there, but yet, because of the lack of NGOs there, access to very basic healthcare is probably still a huge challenge.
Yeah, I can see how devastating situation that has been created for these refugees, and how different is this compared to the healthcare that regular citizens of the Malaysian country get. So I would just like to ask, how does it differ when comparing to access to healthcare available by Malaysians? Although it has been very clear from your question, from your answer before this.
Yes, I think probably we could also discuss a little bit, the kind of treatment they may receive in some of the facilities because of, quite rampant or widespread xenophobia now. Many of them are turned away on the slightest excuse if possible, even though they may be, facing, severe medical conditions. They may be turned away because they may not have money to pay for deposits. Sometimes they may not be admitted, or they may be asked to also, go for their own discharge at own risk. Sometimes they're advised to do that, but many of them actually don't understand, what it means to discharge at own risk. But because they know they can't pay anymore, they don't stay on and they agree to sign off and go. So this is not something that would happen to Malaysians. I don't think any health personnel will dare to advise Malaysians to go out of the ward and sign this paper without explaining in full what it means in terms of the consequences on their health. The other thing is also Malaysians, I do actually in the public facilities, sometimes Malaysians do struggle with language also. This is something that in terms of cultural competency, many of our doctors are still not quite, I would say, familiar with some of the cultural differences, even among Malaysians. Hence, a very, very culturally competent healthcare system is needed to just deal with Malaysians. But you can imagine that this will be even more difficult for refugees coming from a different country altogether, for them to put across their problems to to health personnel who don't know their language and don't understand their culture. So that's another challenge, and that will be a difference in terms of how they may be treated compared to Malaysians in terms of this lack of understanding of cultural differences and the language barriers as well. I'd like to add one thing. I don't think Malaysians will struggle with having to deal with police on the way to the hospital, because this is a real threat that even if they hold cards, they may be stopped by the police and asked for the ID, which is adds to their tension and anxiety. So this is something Malaysians may never experience when you're already sick and trying to access healthcare and being stopped by authorities and asked where you're going, and the chance that they might be arrested on the way to the hospital.
Thank you, Dr. Sushila. That was indeed an interesting discussion. The next question is to Dr. Sharon. So, Doctor, as we are discussing on access to healthcare and what is offered in Malaysia, I think there's an anticipation from our viewers to know how various stakeholders addresses the gap.
Thanks for the question. Yeah, that's a really interesting and important question. And I think there are so many layers to it. So if you think about what Dr. Sushila has said, and you think about who are the stakeholders and who work within the healthcare setting and who actually oversees the entire provision of healthcare in a country. So certainly if you think about stakeholders, the government is a stakeholder, because it's we wonder, right, whether one of the things we often say is that health is a right. Everybody should have a right to a certain level of healthcare, and that because we live in a country and we are a community, the government has a duty, or we elect the government on the understanding that they will provide for us in certain ways, and that includes providing us with a certain level of healthcare. So, and if it's a human right, regardless of whether or not we're citizens of a country, then the argument would then be that the government or the state in any country would have a certain responsibility to ensure that everybody within that state has some access to healthcare, because it's not a citizen right, it's a human right to have that access. And the question then is, what can or should the government do in order to provide, and that's a really important thing, right? To address this gap by providing equitable care. How do you provide care that is affordable? And so there's so many layers. Why is it not affordable? Is it not affordable because you have costed the healthcare too high? You are charging them private rates, which are beyond the rates that actually are the cost of providing that care? Or is it too high because you don't allow them to work, so they can't earn a living? Therefore, how do you expect them to pay? So it's really what what is equity, right? So what are you trying to reach? You're trying to say that everybody that lives, and any human being, should have certain access to a certain level of healthcare. If they fall sick, they should have medications, they should have access to vaccinations, they should have access to good healthcare advice in relation to keeping healthy. And why is it, and what is it that is a barrier to refugees within our community? Is it the law? Is it the government? Is it politics? And then at another level, it's the actual provision of healthcare. And I think that's a really important point that Sushila raised. And that's what we would call clinical ethics. Once you come into a healthcare facility, how should you be treated? What are the duties that doctors and nurses and other healthcare providers owe the people who walk through the door? To treat them with dignity, to treat them equitably, to have proper translation services, to not yell at them, to not abuse them. And I think that tends to be a problem as well, the stigmatization of refugee populations, and they're sort of marked as being difficult or criminal. And then they find it very difficult to genuinely access meaningful healthcare, because if somebody is yelling at you and not really listening to your healthcare problems, chances are they're not going to make a good diagnosis anyway. So there's that gap and responsibility, I think, on professionals. But the flip side is, because it's so hard, you will find that some professionals actually take on more than you would expect. So some healthcare professionals go above and beyond to provide care even where there's no more money. They will still help, you know. And there are some even public doctors or private doctors that will treat, and they themselves will sign the guarantees for the refugees because they need care. And then you think, is that right? Should we expect that of people? Is that what the system should be if we're talking about access to health care? And then at a third level, we have the gap being filled by, for instance, civil society, which is members of the public or groups of people who belong to certain either religious groupings or just who are like-minded, who then pump in private money to provide this care for people who are failed by the state, or who are not receiving the care that they should be receiving, or who are afraid to receive the care because the whole environment around them is so dangerous, because they may be arrested at any point, and so maybe they don't even dare go into a public clinic, and they land up looking for private healthcare services. And it makes you think, right, in terms of duties and stakeholders, how much are you and I responsible for actually picking up where the government or other agencies have failed to help our fellow human being, and what should be our job, what is our duty? And maybe in a democratic society, what is our duty to raise the voices or the stories of people who are in such situations, and to advocate for them and to get change? Because political change comes hopefully through, you know, the citizens of Malaysia themselves changing and raising their voices and telling the government it's not right, or that we want to be able to provide fair healthcare for everybody. So I think, I'm sorry for a very long answer. It's everybody's responsibility in a certain way, and we all have a role to play.
Thank you so much for that, Dr. Sharon. I think one key takeaway that I can take from what you have just shared would be like, us as a society, as a civilian society, we do have a certain threshold that we should achieve in providing healthcare for these refugees, because as what you said, healthcare is a human right, and we should try to work towards that. As a follow-up question, I think you do have answered this previously, but I would just like to ask again, what is the different perception that we have as a society on the duty or responsibility of different stakeholders on the issue of equity here? I do understand that we have to treat our fellow refugees as brothers and sisters, but where do you think we are lacking, and how do you think we are pushing the stakeholders to take upon all the responsibility?
Again, yeah, I think depending on where we are situated, we all have a certain level of responsibility. So I think if you're a healthcare provider, if you're a doctor or you're a nurse or you're a allied health professional, you have a duty to uphold the principles and the ethical standards that you were taught, to treat everybody with dignity, to not discriminate against someone because of their social economic status or because they're refugees. I think that is a duty that is owed to every single patient or every single person that walks through your clinic or hospital, no matter what you feel personally. I think as a government, you have a certain duty to the people within your borders who come to you. And I think this is quite controversial. So there are all these different theories of what governments owe to whom. And to a large extent, governments feel that they owe duties to the people who vote for them, because that's how they come into power. So indirectly, that means that you and I have a duty to speak truth to our government, to tell our government to advocate for equity where there is no equity, to push them. I think it is the duty of the state to manage and to provide a good healthcare service for everybody. Even to a certain extent, you know, you will both be lawyers very soon, and you will be working within the legal system. Maybe you will be judges. I think it is the role of lawyers to fight for people whose rights are not being respected, to really advocate for them, because you've been taught how to be advocates. If one day you become judges and you're looking at something like Article 5 of the Constitution, to really advocate for the right to health and to recognize that it's a human right and it's not a right just for citizens. So I think wherever we are, we have a responsibility to look around us to see where there is no equity, or where people are struggling because the systems are unfair, or because people are not being treated fairly, and to do something.
Thank you, Dr. Sharon. I think we would also love to hear thoughts by Dr. Sushila on this matter as well.
Yeah, it will be kind of bridging into the kind of gaps that we want to also address, because once I speak about the roles, I think it will really touch upon what needs to be done in this country to get things going, to ensure equity and for healthcare access for refugees. I think first and foremost is for the government to have a policy that helps make it clear for all agencies and actors how refugee issues are to be managed in the country. Currently, there's no such policy. I think they're working on a directive, but this is still not made public yet. Without this, I think all agencies struggle to work together. Many have good intentions to want to support the issue, whether they are public or private or in the NGO sector, but they struggle because there's no framework within which they're working in. The government does not need to actually ratify the convention to allow this to work. There are many conventions that they've ratified, the Child Rights Convention, the CEDAW, and even just the Human Rights Charter in terms of right to life, right to health is enough as a basis to go forward to assist refugees on this. With the policy, then if they can have access to legal work that covers a lot of the social determinants of health already, they may be better positioned to afford healthcare. Then it comes to more specifically the public health programming for refugees. That public health sector needs to plan for inclusion of refugees, because it is for the larger good, for the greater good of all, that public health consequences are avoided. Because if this is not managed, it becomes an issue. Whether it is just infectious disease or any other disease, I think it's clear that you can't leave out a significant number of people who are on your land from public health planning. So what that entails would then be to look at, what is the financing scheme that's available to allow for refugees to then contribute and not become a burden to taxpayers in the country, because that's always cited as the excuse as to why they are not having a system to manage their healthcare. So they want to prioritize that the resources are given to citizens only. Rightly so, but then there can be ways to allow for non-citizens to contribute, and then they can access healthcare. That contribution can be used to strengthen the health system in terms of equipment, clinics, services, extra human resource to deal with the numbers that they're serving. This may be in the form of an insurance, or maybe better still, a trust fund of some kind, that a pooled fund that goes straight to the Ministry of Health, and they can use that money across to have more comprehensive health programming for all non-citizens alike, refugees, migrants, whoever. That way, there's revenue coming into the government as well to manage the problem. So there lies, the role of government in actually providing that system to allow for all the rest of us to work and serve as, for doctors to work in a more comfortable manner as a clinician, that they can do what they're trained to do without worrying about the other factors of managing the patient. And then we are also looking at, NGOs can play the role in supporting the government in reaching out to pockets that cannot reach public health services. Do vaccinations out there in collaboration with government, ensure vaccination coverage is improved, or ensure that every pregnant woman has access to healthcare. So even if they just look at basic things like if they can't cover the cost of everything, at least at preventive measures and life-saving measures for vulnerable sections of such populations. Example, just providing vaccinations for children so that you don't have outbreaks of vaccine preventable diseases, and hence preventing a lot of morbidity and mortality. And the other is that, the vulnerable women who are pregnant, at least they have access to healthcare, so the two lives on their hands are actually taken and protected for. So the private sector can then come in further in terms of supporting some of this access to maybe insurance, sponsor a refugee child, to get healthcare for the year, that sort of programs could be had. And we all know that, in COVID, at times of crisis, all these sectors work together so well. So this should be tapped into again to see how to address this issue. The government should know that they're not alone on this, but they need to lead in coordination and setting the framework for things to work. Yeah, I think the roles are there, and we have probably looked at key reforms that are that are needed to advance equity and bridge this gap.
Yes, thank you, Dr. Sushila. I agree that we need to reform policies to better support these refugees, including access to insurance and healthcare programs. Therefore, before we end our session, are there any thoughts or messages that you have for our podcast listeners?
I think since these are all law students, I think be very familiarize yourself with all the challenges that marginalized populations in the country are facing, whether in terms of healthcare or in terms of accessing basic rights in the country. I think read more things that there's the internet is full of information. Be discerning and look for things that will help enhance your practice as future lawyers in the country, to be the voice for the people without a voice.
Dr. Sharon, would you like to add on?
Yeah, I totally agree with Dr. Sushila. I think for our listeners who are not very familiar with issues of access to healthcare and refugees in Malaysia, I would urge you to just go and find out more. There are a lot of civil society organizations that work in this area. Volunteer with some of them, find out what the situation is, and do what you can where you are. So as future lawyers, as Sushila said, that is your power. When you go out there, think about how the law can be used in ways that empower people. And it's really interesting that, I was thinking, I should have said something about the Convention on Refugees, and I'm so humbled to hear that Sushila is saying, actually, you don't even need that. All the conventions that we already have, all the laws that we already have in our country today should be able to provide protection. So just to really know them and to know which tool, I was going to say weapon, but that might be a bit much, which tool to pick up and to use to help that person in front of you get access to whatever it is they need, whether it's healthcare, whether it's education. And I think that would just learn more and understand what skills you have, upskill yourself to do what you think needs to be done, and just do your bit.
Thank you, Dr. Sharon and Dr. Sushila, for this enlightening session. As reiterated before, healthcare is a human right, and with sufficient law that we have right now, that the only thing right now is to advocate for it. So we have learned a lot talking with both of you. To our listeners, thank you for tuning in to this episode. We hope you found our conversation as enlightening and engaging as we did. We'll be back soon with more insightful discussions on topics of current issues. Until next time, take care and stay curious.